Good afternoon, everyone. Welcome to Nashville General Hospital's Wellness Wednesday program, highlighting today family medicine. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesday is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Joining us today is Dr. Sands. Dr. Sands will be the new medical director for the Nashville Healthcare Center Bordeaux Clinic.
Thank you,
Dr.
Kaylin.
Sands.
Sorry.
That's okay. Dr. Sands is an experienced primary care specialist whose interest in medicine began as an undergraduate at the Johns Hopkins University. Her interest in caring for the elderly and appreciation of the integration of research into clinical practice continued through her work as a research assistant at the Johns Hopkins Medical School and National Institute of Health Gerontology Research Center. She completed her education and training at Michigan State College of Human Medicine. Please welcome Dr. Sands.
Thank you, Kathy and Kaylin. I'm very happy to be here today. I love talking about primary care, and I look forward to sharing some information with everyone. My goal today is to introduce myself and to remind you of what primary care can and should be doing for you. I hope to gain your trust and confidence and become a resource for you in your journey towards better health and well-being. Here's our agenda for our discussion today. I strongly believe that people suffer for a lack of knowledge, and my job is to provide patient education on their illness, understanding of self-care, and better utilization of resources, which are key to good health. Sometimes I think as physicians, we spend way too much time speaking about illness and sickness that we forget to tell you how to keep yourself healthy and avoid complications. I'd like to spend our time today helping you understand how primary care can benefit you and your loved ones in these areas and share some exciting news about our practice opening in the Bordeaux to serve the North Nashville and surrounding areas. I planted roots in Middle Tennessee in 1998 when I was recruited by Vanderbilt to work in one of their clinics. My interest in medicine started at Johns Hopkins, where I received my Bachelor of Arts and studied public health. I returned to Michigan to complete my doctorate degree at Michigan State College of Human Medicine because it has the reputation of putting out primary care providers, and I believe that's how I could make my greatest impact serving my community. I remained in Southfield, Michigan to specialize and board certify in internal medicine at Providence Medical Center. When Vanderbilt recruited me here to work at their Antioch clinic, after a year, that clinic closed, and I was so committed to the neighborhood and community that I opened up my solo independent private practice and continued in that to serve that area for many years. By God's grace, I was able to nurture my entrepreneurial spirit and balance full-time practice with being a single parent, raising 2 kids in Franklin without any family within 600 miles. Now I'm remarried to a native Nashvilleian and living my best life working with an exceptional leadership team here at Nashville General. I bring a lot of experience and a true appreciation for primary care to the table. I'm happy to be here today, and I look forward to raising more excitement in the community about primary care. Well, what has your primary care provider done for you lately? What is primary care and where do you get it? This is important because if you're looking for it in the wrong place, such as the emergency room, you will be disappointed. Your primary care provider is there to teach you the ABCs of your condition and to help you understand the 1, 2, 3s of your treatment. Primary care works best when it's patient-centered to meet your needs, and we are your first call when that need arises. High-quality primary care focuses on developing a partnership relationship with you, where you feel comfortable asking questions and addressing your concerns. Many factors influence a person's health. You should be screened for those stressors that contribute to poor health, such as inadequate housing, inadequate food, and transportation issues. Health literacy refers to your understanding of your condition and your treatment plan, along with how best to use the resources available to you. Your primary care provider's job is to break down complicated medical talk in terms you can understand in order to achieve whatever goals you have set. This must involve focusing beyond the usual markers of disease, such as those driving progression and risk and affecting your management. To summarize, primary care involves both doctor and patient agreeing on what can be done today that will make a difference for you tomorrow. Your family history is important and you cannot escape your gene pool, but you can manage your risk. There is tremendous amount of useful information in the family history. The area where you live and the activities you engage in that is useful in establishing prevention strategies. Risks are simply the possibility of injury or condition developing. I believe managing the risk is one of the areas that has been unequal for minority communities. And this is because when we finally decide to show up and get things checked out, what started out as a minor issue often has developed into a more severe one. Doctors focus on severity first, which leaves little time for risk management. That's why it's important to have conversations like these to encourage you to help you get healthier as a community by utilizing the right services at the right time. Just like I said, no one knows you better than you. No one can defend you against illness better than you. And that starts with taking measurements of your vital signs of life, which are your blood pressure, your heart health, your breathing, and assessing the vital organs, then setting a strategy to defend them against injury. What determines our success is our execution of the game plan. Many people have not developed a relationship with their primary care provider, and instead they use the emergency room for basic care. But the emergency room is not designed to take the place of a primary care office. The emergency room is there to treat life-threatening illness or accident, which requires immediate or intensive treatment. People may decide to go to the emergency room because of the convenience of it being open 24/7. But if you show up and don't have an emergency, they will tell you to follow up with your primary care provider, such as myself, our Charlotte 1919 clinic or a specialty clinic. Sadly, without primary care in their communities, many are forced to use the emergency room in this way. Nashville General Hospital has committed to improve the situation for Bordeaux by opening up a new facility. With that foundation of good care in mind, leadership at Nashville General decided to build a new primary care practice in the Bordeaux area. They studied the area and determined that it was a healthcare desert. This means that people who live in that area have inadequate access to healthcare and preventive services that are convenient for them. What's important about healthcare deserts is without intervention, those populations have worse outcomes, more severe stages of diagnosis, and higher rates of complications. Nashville General has been around for a long time working to improve the health of this community. Building a new facility out in that area aligns with the hospital's mission and vision to provide equitable access to high quality, coordinated, patient-centered care. That's why I joined the cause. People think about your family, your neighbors, and your coworkers, as I described, who will be good candidates for our new practice. I'm asking for your help in getting the word out and getting people scheduled. We will see adults over 18, and we anticipate being able to accept all major insurances, including TennCare, once my credentialing is complete. Any one of you who has a chronic condition that has lasted more than 3 months, such as diabetes, high blood pressure, lung disease, or musculoskeletal issues, we would be happy to have you. If you feel your condition is not moving in the right direction or improving, I will try to help. Remember, our chronic care management is designed to reduce hospitalizations and emergency room visits. So if you've been there more than once in a year, please give primary care a try. What will set us apart from our competitors is our commitment to serve with the spirit of excellence, accountability for our outcomes, and how we nurture health and hope in our patients, and the sound doctrine and foundations upon which we build our practice. I will be coaching my care team to provide VIP service to all so that you have the great primary care experience this community you deserve. The facility will be a state-of-the-art facility, including full imaging center, providing ultrasound, CAT scan, and MRI. We'll also have a lab and specialty care rotating through on the site. We want to bring you the best to Bordeaux so you can believe for better health with us. And I help bringing new hope to old challenges, health challenges will help you because at our practice, we are putting together a team to address your needs for total wellness. I'm happy to answer any questions that you might have and receive your comments and concerns. Thank you so much for having me today.
Thank you very much, Dr. Sands, for sharing your presentation on primary care and informing people more of why we're bringing this clinic to Bordeaux and all the influences and all the positive outcomes that will result from that clinic being there. So I know to all of our viewers that are watching this in cyberspace, I know that you all probably have a bunch of questions for Dr. Sands after her presentation. Please make sure you can comment on this video. You can also message the Nashville General Hospital Facebook account if you have any questions at all. But we can begin our question and answer with Kathy.
Thank you, Kaylin. I love how Dr. Sands, you described everything and the type of care that you're going to be providing, especially that VIP experience. And I know we're right now getting into flu season. So can you give us your thoughts on, should we take the flu shot sooner, wait a couple of months, see how other people are reacting to it, take it later, and then do we need another COVID booster? Like, how does that all work together? What are your recommendations for that?
Yes, thank you for that question. That question is perfect for primary care. So yes, I do think the flu vaccination is important, but I don't want to just give a blanket answer because the beauty about primary care is we're able to assess your particular needs for each person and provide personalized recommendation for you. But I do think it's important, especially for those who have risk factors that put them at risk for complications of flu, and you have to weigh the pros and cons of the vaccination. Typically, the vaccine will help you prevent complications such as hospitalization, the development of pneumonia, being very sick and weak. And so you take the vaccine to avoid those things. So if you have a condition that puts you at risk for that, I definitely would recommend the vaccine, as well as if you're elderly and living in a group home or a situation where you're going to be at greater risk, definitely consider taking the vaccine. But my advice is to meet with your primary care provider and decide on your personal risk and make a decision for your particular circumstances. And your second question was regarding the booster. So the booster is very important. The booster really is important for you in protecting you from any new variants that might develop. So the booster is important. Again, not a blanket answer, but assess your risk and with your primary care provider, decide if the booster is beneficial to you when you weigh the pros and cons.
Perfect. So I do want to ask a very, I guess, preliminary question. So when I know you talked about your patient population or that wish list of what your patient will look like, but if someone is seeking care with Nashville Healthcare Center, how does it work if, I don't know, at what time in my healthcare cycle do I come see a primary care provider? I know a lot of times people just think, oh, one doctor should be able to treat everything I got. If I have a broken leg, if I have a stuffy nose, if I'm cramping. So at what point in time are you the first stop and then I'm referred out? Or do I see a family medicine provider and then come to see you?
So the primary care provider, because we train 11 years to diagnose, treat, and manage conditions, and we treat conditions from A to Z. I would say make that your first stop, because we can better advise you and also reduce your costs so you're not utilizing services that you don't need. So many of those symptoms, bring those to us. Let us get you started on that, what that journey looks like for you. We can advise you on what you need to diagnose and manage. And the important thing is we can advise you on your self-care.
Oh, that's good. Thank you. And my next question was just going to be, so I know a lot of times, well, with our particular patient population here, you tend to have people who are kind of nervous to go to the doctor, who get kind of fearful when they have to go into, the white doctor's office with the white walls and everything's all sterile. So you as a provider, so what are some unique things that you do to try to make your patients feel more comfortable, man or female?
That's a good question. Thank you for that. What I try to do is I try to be authentic in my compassion for the patient and my interest in them. So when you come into my office, I try to let you know that I'm there to serve you. You are a consumer and you have choices, and I want to be that choice for you. So I'm working to earn your business. I'm working to communicate well with you. I want to make sure that you understand what the game plan is. And I want to allow you to set the agenda. What's important for you? What concerns do you have? And I also want to hear about what goals you want to have. How is good health going to help you in your goals? What do you want to accomplish? So I think that that's how I approach it personally. And I think that that's the key to a good partnership with the patient, because I don't want to be the doctor who tells you what you have to do. I want to lay out the choices for you and help you make an informed decision for your own care based on your preferences and your values.
Thank you.
I love that. You continue to talk about that personalized care and really being a partner with your patients and you as the provider. So, I'm part of that sandwich generation. So some of the challenges that I think happen is, there are urgent care centers going up left and right because the generation behind me, or maybe the generations behind me, tend to not really establish care with a primary care physician. But then like my parents' generation, they always had that family doctor. And as they're aging, a lot of those physicians are retiring. So how can you bring the two together?
Well, I think that involving those generations in the care in one place is how you do that. And you do that by making it convenient. I think that that's the thing. Most of the time when people go to the urgent care centers, it's because of convenience. And at the Bordeaux clinic, we're going to have extended hours till 7 p.m. so that we can accommodate working families and those adults who have to support elderly parents and attend their care visits. So I think it's just being convenient. And we'll also have telehealth visits, so we can offer that as a convenience as well. But I think key is to understanding that urgent care centers, they're not going to know your background. They're not going to develop that relationship with you. They serve a purpose. But if you want to develop a relationship with a provider who knows you, who knows your conditions, knows your allergies, knows what you're sensitive to, what medications you can't tolerate, then primary care is your answer.
And my next question, I know that Nashville General and where Nashville Healthcare Center and Nashville General Hospital sit, we're between all of these colleges and these universities. So, and I know that you said, your patient population tends to be 18 and older. Is there anything or any advice that you would give to any students that are moving onto campus who are, trying to find care, or, we've all been in college before. So, you're dealing with your allergies, you're trying to call your mom for this, or you're trying to get this figured out. So is there anything that you generally see with your younger patient population that may be in college and away from home and from their primary doctors there, that you can kind of give them some advice or some things to not worry about, to stray away from?
Yes, I think it's an exciting time when you're establishing yourself on campus and you're making your own decisions. And I think that developing a relationship with a primary care provider is a good tool for you to have as a resource. So you can ask us questions when you need to. We have a portal that you can utilize to send us messages, and we can answer messages for you. We also have telehealth appointments so that you don't have to interrupt your studies, hopefully. So I think the answer to that is, don't be afraid to engage with a provider that you feel comfortable with. I think that's really important. And don't be afraid to keep looking. So if you meet with one provider and that provider doesn't work for you or doesn't meet your need or doesn't communicate well with you, keep looking. And don't give up on primary care, because there are a lot of providers out there. We all have different personalities. We all have different philosophies of practice. We all base our practice on different standards. And so all of those things are important. But at Nashville General, we are happy to be here to answer your questions and help you navigate and find somebody that you can work well with. I look forward to working with those students.
Thank you. Kathy, do you have any other questions for Dr. Sands?
I was going to ask about how you transition a patient to a specialist. Is that something where if I have, a cardiology need, or if I need to go to a GI physician, do I have to come back to you afterwards? So how does that transition back and forth between primary care and specialty care work?
So particular to how I practice, I like to have follow-up visits because I like to make sure that your needs have been met. So just because I send you to a specialist doesn't mean that the right conversation took place or the right studies happened. So I want to make sure that I meet with you and ask you, how was your visit? How was your experience? Did you accomplish what you wanted to accomplish at that visit? And to make sure that there's no follow-up that needs to be done, so I can help keep you and the specialist on track. That's one of our jobs as primary care provider. We help you navigate through the complex system. I hope that answered your question, Kathy.
Well, then I was going to say, if I become an inpatient, I know there are providers called hospitalists internally, so you would be working with the hospitalist on any issues I might have as well.
Yes, so we work closely with those. We have a follow-up visit called the transitional care visit, so that we know that you understand what your hospitalist advised you to take as far as your medications and your self-care program, and that we help to monitor you as an outpatient and help you decide when you need more intensive care.
Okay, perfect. Well, I believe that's all the time that we have. I don't have any other questions, but again, I definitely thank you, Dr. Sands, for being on today and discussing the Bordeaux clinic and bringing more healthcare to that particular area of Nashville. We're super excited to see everything that you and the team does in that area. But also, I do want to remind everyone, if you have any questions for Dr. Sands after this program goes live and is aired on Facebook and on YouTube, please make sure you comment or directly message the Nashville General Hospital accounts.
Thank you. Thank you for having me.
Here I go. Dr. Sands' appointment template is actually going to be opening up within the next few weeks. So please give us a call at 615-341-4968, or you can visit our website, nashvillegeneral.org, and click appointments, and we can get you set up to see Dr. Sands.
Have a lovely day, everyone.
Thank you.